Hello class, this presentation will be on an overview of the cholera disease. Cholera has a history of causing pandemics and epidemics around the world. One example being the mid-1800s London, England epidemic, where the reservoir of the infection was one of the many water pumps located throughout the city. The causative agent of cholera is the cholera toxin. This exotoxin is an AV toxin and it's produced by Vibrio cholerae. Not all V. cholerae produce the toxin. So far, only two serotypes are known to produce the cholera toxin, which include the O1 and O139. This diagram shows the mode of action of the cholera toxin. When the toxin enters the intestine, its B subunit binds to receptors in the intestinal cell, which allow A subunit to enter the cell, which initiates the overproduction of CAMs, which accumulate and causes sodium, potassium, and water to exit the cell. The mode of entry of V. cholerae is through ingestion of contaminated water and the using of contaminated water to prepare food. The cholera infection is often mild or without symptoms, but can sometimes be severe. Approximately 1 in 20 infected persons will have severe disease, characterized by excessive diarrhea, which is sometimes described as rice water stool, vomiting, tachycardia, which is an increase of heart rate, dehydration, which includes the loss of liquids, potassium, sodium, and electrolytes. This could also lead to the skin losing its elasticity and causing the mucous membrane to dry out, which includes the mouth, throat, nose, and eyelids. If severe dehydration goes untreated, it could lead to shock and death. Other symptoms include low blood pressure, muscle cramps, and restlessness. To diagnose this disease, certain techniques are used. These include stool culture and thiosulfate citrate vial salt agar. Stool cultures of patients are collected by physicians and are examined through gram staining. The medium thiosulfate citrate vial salt agar is used to confirm the results from the stool culture because it's a selective medium for V. cholerae. Due to cholera, lots of essential fluids, electrolytes, salts are lost from the body. Once the disease is diagnosed, rehydration therapy is prescribed by a physician to restore all the essential fluids lost, and especially potassium, back into the body. For short-term relief, antibiotics such as deoxycycline is used for the moment. Prevention. A way of prevention would include the using of basic hygiene needs, which include washing hands after touching anything that might be contaminated with the V. cholerae strands O1 or O139, having access to safe water for people to drink, and sanitation, which is the usage of any proper procedure to filtrate water. One example could be the boiling of water before drinking or drinking water that has been chemically disinfected. Education and awareness also could help on the V. cholerae. Thank you.